Yeah, it's working. Okay, so just for the record, in your guys' own words, series of events. Noel, were you at work that night?
Yeah. Yeah, I was just coming off shift. We get off work at 6, and it was about 1:45. I was just getting off shift, and I started feeling pains in my jaw, and then it went down my neck and across my chest, down both arms, and there was another fellow riding with me, and I said, well, maybe you better drive, I'm not feeling good, so we left the mine, and it was probably 5 to 6. So by the time we got to town, I said, you better take me up to the hospital. So we got to the hospital. I believe it had, well, it couldn't have been more than 20 or 25 after 6 p.m. So then Dr. Eva was there when I come into emergency. And then right away, he kind of knew what was going on, so they put me in the emergency room, and then they give me a shot of nitro under the tongue. And they ask you what your pain is from level from 1 to 10. So I said, it's an 8. He gave me another shot. So what is it now? It's a 7. So then they wait a while, and the pain was still pretty fierce, so he gave me 2 more shots on it. Then he asked you what it is, and I says 6. And then they give me some other, like they start an IV with, I'm not sure what that, I think there was some
Just a liquid.
clot busters and then morphine, so. But the pain was still there, like I never did get rid of the pain.
So what's the next question?
So then he told me that the chopper was, we phoned for the chopper, and it would be there within the hour or whatever. So then, I'm not sure exactly when they said, but it was a while later. Says, yeah, well, the chopper's not coming.
About an hour later, they said there won't be a chopper.
So then we got to get the the ambulance from Penticton, but they can't come right away because there's, and this was like 8 o'clock or something. So they're going to be like another hour and a half before they get here.
Should just put him in the car right now.
So then, I believe it was around 11 when the heart team showed up from Penticton. And then they did their assessment, whatever they do, and put me in the ambulance. And then my daughter come with me in the ambulance.
And you were in a massive heart attack.
And I believe that, well, I never got to Penticton until 1 in the morning. And then they never took me to Kelowna, is where they done the surgery, and that was 10 o'clock the next morning. But I don't recall everything because I was...
Sure.
What do you think of Fisher, whoever Fisher is, saying that it wasn't urgent, that the urgency had decreased?
Well, I would say he doesn't know what he's talking about.
Exactly.
He wasn't the guy laying in the
Who is he to make that call? Exactly.
That's what we'd like.
100% blockage. Massive heart attack. Wrong call, buddy. His family doctor said the only reason that he lived is from the big guy upstairs. No other reason.
And there was something about a fax. What's the story?
Dr. Eva, I went to see the doctor for refill the other day on the 30th of June, and I don't know if he thought I was Diane, like he gets us mixed up all the time, but I heard your whole night. He told me everything. We talked for like 15, 20 minutes, and he said he had faxed a specialist or a doctor over your heart wave things or frequency things, your test, your ECG or EKG, and the doctor didn't get it. The specialist didn't get it, so the specialist called Princeton, called Eva, and said it's been over an hour and it hasn't transmitted through. So Dr. Eva had to do it again over an hour later.
And that's when they said to get him over.
Yeah, once the doctor saw your test, he knew it was bad. It was massive. to get you out of there. He should have been out of there hours and hours before this.
But to have the heart response team to sit there and discuss how they were gonna get him out to the hospital, I don't think that should have taken an hour.
So when they showed up at 11, it was another hour before.
So, I bet you.
What time did you get there,
No,
Noel?
I got
1?
one.
1 o'clock. So he was in a heart attack from 6 p.m. until 1 in the morning.
Well, so the next day when they put the stent in, never mind.
Well, at least he had real help or
Yeah.
a real
He was
team.
monitored,
You
yeah.
know, he had
The
a
pain
chance once he got there.
The pain never really went away till I had the stint.
Wow.
Really? And so the diagnosis in the end was 100% blockage.
Yeah.
And situation sort of by the skin of the teeth. Did anyone talk to you guys about what happened on the ground with cross coverage as far as ambulances coming
Haven't
in
heard
from?
one word.
Nothing?
And that's what we want. We want answers. I don't trust the
No, really
system
does.
anymore. I'm afraid to live here.
No
I
one
want
has
to
got
know
it.
that if I have a heart attack or Noel has another one or my sister or somebody breaks their arm or neck, I want to know we're covered. And we want answers and we want a public apology.
Has IHA ever contacted any members of your family? Any discussions between?
No.
No.
Nothing.
Nothing at all.
Nothing.
So how do you you're off work right now, Noel, obviously.
For 3
I'll
months.
be
For-
off in 3 months.
You'll be off for 3 months. And in retrospect that night, so Eva had to take time away from managing your situation to deal with the paperwork, with the faxing. He was working on you and then not.
Yeah.
And so from the time that you were admitted till the time that the heart team rose, so you were probably in the hospital if you left the mine 5 to 6, around 6:30? Or
Yeah, I would have been in the hospital at like
Five and a
no
half
later
hours.
than 25 after 6.
right? And so from 25 after 6 until the heart team arrived at 10, that's 4 hours. And any explanations to the family that I understand that you were all there, is that right?
Yes.
So you were
Yes.
there. And did anybody talk to you about what the transport situation was or why or?
It looked like it was all just a big mix-up. Nobody knew nothing at first. What happened to the helicopter, what was going on with the other ambulance. A little while later, we found out why the ground ambulance had to stay in town for the town people. But I don't think we ever got a clear answer on why the chopper didn't come. Did we know?
No.
And has there been any contact since with the care workers that were there? Are they talking to you about that situation or?
The hospital did tell, Amy told me that the hospital did tell you guys it was all right to make a complaint. So this is what we're doing, and that's part of my Facebook thing. But higher authorities have to handle this now. We can't live like this anymore.
But I haven't talked to anybody that was associated with the whole ordeal. So.
And
Nobody's contacted me about it.
no, and at the end of the day, how do you feel about it? Would it be better for you if somebody explained what happened, or?
Oh, definitely.
Yeah.
I mean, it's not very good care, that's for sure.
No.
You know, I could have went either way that
That's right.
situation.
And you pay your tax dollars for care. We live in Canada.
Not a third world country.
We pay more taxes per head than Penticton does.
Yeah.
We pay HST like everyone else.
That's what it pisses
And what
me
are we
off.
paying our tax dollars for?
The next time it's going to be a little kid or something that dies because they can't, you know.
Yeah, and will IHA be responsible when one of us do go, one of our kids? Will we be able to hold them responsible? Someone has to take responsibility here.
Before a life is gone.